I would advise anyone with varicose veins to at least come in for initial evaluation. This is one area where an ounce of prevention is definitely worth a pound of cure. If you have pain, swelling, discoloration of the legs, you definitely need to be evaluated. At our office, an evaluation takes about 2 hours total. It includes an ultrasound of your legs, which shows us the anatomy of the veins. Figuring out what the cause of the vein disease is kind of like a detective story, and you have to figure out who done it, and then you can figure out what to do about them. You see my nurse and the vascular tech, and then I will evaluate you and look at your ultrasound as well. And then we'll formulate a plan to take care of you. Depending on what your problem is, we can formulate different plans. The nice thing is that we do everything in the office. You don't have to be put to sleep. You can drive yourself to the appointment. Most treatments take about 20 to 30 minutes max. Different things that we might do, depending on how severe the problem is a radio frequency or a laser ablation, a special foam called Varithena, which we inject under ultrasound. That sticks to the vein walls, and basically your body reabsorbs that vein over a period of time. And then it recycles the components of the vein that it needs, the ultimate recycling, I guess you can say. Sclerotherapy, which again is injection of a medication to make the veins stick together, and phlebectomy are also options. Yeah, people can drive themselves to the office, and when we're done, they walk and drive themselves home. They do well, very minimal downtime. I hope so. Yes,
In a perfect world, right?
yes, we follow them closely. Again, venous disease is a progressive disorder, and we check with ultrasounds and examinations over a period of time and make sure that the disease isn't progressing and that the treatments that we have done have been successful. It can come back, but that's pretty rare. With the radio frequency ablation, for instance, the success rate is about 98%. And even at about 5 years out, the success rate's still over 90%, which is about as good as you get in medicine. It's possible to get other varicose veins due to a different problem. Varicose vein disease or vein disease is a progressive disorder. And if you have some veins where the valves start to fail, you may get other veins where the valves start to fail, and that again may cause some more varicose veins. Right, so we would evaluate that. Basically, we would do the ultrasound again and see why you have the new varicose veins. Once we figure that out, then we can formulate a treatment plan to take care of that. I think now more people are learning in the United States, but people, when they think about varicose vein treatment, think of being put to sleep in the hospital, have vein stripping, be laid up for 6 weeks with railroad tracks all over your legs as scars. That's no longer the way that we treat them. We do everything as an outpatient in our office. Typically, the treatments take about 20 to 30 minutes, and you go home right away, and then you can go back to work usually within a day or two.